Welcome to the Deep Six podcast, where we make a generational impact on you and yours. What we do here is explore a 6-point model into your health, your life, and your journey while you're here. So let's dive deep and help you thrive, not just survive. Well, welcome again to the Deep Six. I appreciate you joining us. And as always, if you're enjoying this and learning something, hopefully you're learning something, or at least being entertained, subscribe, share this with others, family and friends, loved ones, because this can really impact your life in a positive way, because knowledge is everything. And, you know, the more we learn, the more we share, the more you build good community and good love and education like this, the better the world is. So again, thanks for joining us. This is another AMA, and that stands for Ask Me Anything. We didn't get through some from my last AMA, so we're going to finish up on some new ones, and or ones that have were sent in and we didn't really address yet. And hopefully these really we picked three essentially that were big ones. Maybe we'll get to the fourth one, but we'll see. But that were just questions that I thought were really important, because when I read them, I thought of many patients that I've seen in the practice, and how this has really impacted patients that I've dealt with the last 30 years or so at Longevity Health Institute, and my my colleagues, my practitioners that we work with. We've talked about these kind of cases and these things very often. So question number one. And again, remember, I'm I'm framing this always around what is the Deep Six. The Deep Six is really appreciating the physiology of our 6-point model. So of genetics, of your hormonal balance, of your diet and digestive health, and how you absorb nutrients and all your nutrients, and how you detoxify and appreciating toxins in your body, and the mind-body stress and connection. And like a podcast we did just not long ago with a neurosurgeon about structure and pain, and appreciating pain and valuing structure. And if we're here living long enough, fortunately, gravity does win a bit. So just appreciating those 6 points is so important. And that's kind of what the framing is of this AMA, so just, think of it just always in that way and keep that in context. But this person asking, actually, this is a question from, I think, a relative of somebody, because it says, how and what can cause somebody to have many falls and fractures, especially with autoimmunity? A family member of mine seems to be having this trouble. So, I'm not sure exactly what is happening with the falls, but, let's just talk about falls and gait and balance and stuff like that. So common with aging, common with weakness. That's why it's so important to have structure and function together working. So, we want to go into our 4th, 5th, and 6th, and even 7th decade building and maintaining muscle and bone. And that's going to require hormonal balance. That's going to require activating muscle and bone. So whether it's an activity, a sport, or lifting weights, I always say, remember, do hard things. When you do hard things, you get a result. So as we get older, we kind of want to slow down in that, and you still have to push yourself. And yes, we need more recovery, but do hard things with your body, because that keeps that skeletal system. So, but this does happen with aging. We get more frail, we lose muscle, we have balance issues because the cerebellum actually atrophies and weakens. But my take on this question is, how do we prevent these things? Well, that's one way to prevent. Appreciating hormones, appreciating nutrients that support your body, like vitamin D, vitamin K, magnesium, high proteins, amino acids, androgen hormones, again, testosterone, DHEA, growth hormone, to some degree, cortisol. But they also put this in the context of autoimmunity. So usually when there's an autoimmune reaction going on in somebody's body, and just for the audience, just so you know, this could be anything from rheumatoid arthritis to lupus, to Hashimoto's, a thyroid condition, to lupus, to ulcerative colitis, Crohn's. But ultimately, if we break this down to a cellular level, these are creating inflammatory states in the body. So one of the things that I think that this is, unique, and maybe where I could enlighten upon is when you have inflammation in your body, you are more prone to fractures. Okay, you are more prone to bone weakness. So if this is an aging individual that it sounds like it's a female, but if it's an aging individual and they're becoming a little bit more frail, or with aging, they're what I call skinny fat, happens a lot. We don't really get fat or obese, per se. It's that person that, their weight really hasn't changed, but I can guarantee they've lost muscle, which means they typically have lost bone, and they have an underlying autoimmune condition. They're going to be more prone to weakness in bones and weakness in their cortex, in part the cortex of the bone. Now, part of this, though, just I have to share with you, though, is because, and this is very, very, very common, because autoimmunity's base is in the digestive system. And when you have a bad digestive system and you inappropriately absorb, or you malabsorb, or you create antigen antibody responses, so autoimmune inflammatory responses to things in your diet and or in your gut, you are triggering this inflammatory constant autoimmune state. So not only are you making your autoimmune system worse, but you're also not absorbing nutrients appropriately. And so whether that's vitamin D, again, vitamin K, calcium, magnesium, all these things that are so important for bone health. So hopefully that enlightens them a bit, and what could be going on and could be happening. Now, again, if there's balance issues, you got to look at the brain, the brainstem, the cerebellum. But if we're just talking frailty and fractures that are happening and often, and maybe the individual's clumsy, who knows? But you want those nutrients, you want the mass. So again, do hard things. In fact, earlier today in my practice, I had to tell somebody that twice a week, this person was in their 70s, I said, twice a week, I want you to lift heavy weights, particularly with your your lower extremity, your legs, quads, glutes, heavy weights to where you can only do 6 to 8 pounds. She does have a trainer, so she's going to get good, functional training, and so that she has good form in that, and doesn't hurt herself. But I said you have to lift heavy weights, so that means only 6 to 8 reps. But your muscle should be engaged so much that not only do you have soreness, but that'll guarantee hypertrophy and strength later. And I've seen this work in a patient of mine that's in her 8th decade. So you can build muscle if you have that protein, you're activating that muscle, and you have the nutrients, and that prevents not only fractures, but it prevents falls because you have more stability. But potentially this person needs to get their brain or their cerebellum or their brainstem checked out. And under the context of autoimmunity, I'd really want to make sure that they don't have MS. That's a demyelinization of the brain, which can cause dizziness, sometimes tripping, weakness, and things like this. Great question. Actually, very interesting question in that. The other one here is, what can I give advice about in somebody that really and has for decades had trouble sleeping? Sleep, so important, so important. We do not restore if we're not sleeping. We solidify memories when we're in REM sleep. Yes, we'll get shorter, deep delta sleep as we age. And that's where you get full recovery and you produce most of your growth hormone for regeneration and that. But yes, sleep is so paramount to health and wellness and to life. You can't, it's not heroic, by the way, to, I get a lot done, I don't need to sleep. I sleep 4 or 5 hours. Studies show it's about 7. There's a sweet spot about 7, maybe even 8's too much, but 7 to 8 I think is key. But anyway, what do we do and what can we? Well, I'm big on sleep hygiene. Now my wife probably disagree because sometimes at night I'm watching sports or I'm watching TV in our bedroom, and I might fall asleep. But in general, sleep hygiene is so important, which means you create routine. You go to bed roughly the same time every night, just like you get up the same time every morning. It's cold. The studies have shown this. You keep the bedroom cool. Okay, I actually, my personal bedroom, I like to keep it literally about 66, 67 degrees. And some people even cooler, but people sleep deeper and longer. It's been proven in cooler temperatures. I've talked about this on a previous podcast. I have grounding sheets so that it takes my electromagnetic magnetic frequency more balanced. It helps out heart rhythm and rate variability. It has a very calming effect. But this sleep routine, so cool, dark, non-stimulated, to some degree, keeping electronics, phones, computers, TVs and stuff away or out of the bedroom, try to do that, disengage from all these electronics and social media and that. I'll tell you, there's something going on. I hear this a lot in my practice with patients, moms and dads sharing with you about their teenagers or their college kids and the scrolling on social media while they're in bed. And literally these teenagers and young adults are staying up to like 1, 2 a.m. They can't sleep. Those are dopamine hits. Every time you're scrolling, those feeds in your social media and on your phone are literally meant to stimulate your brain. So you got to get that out of your bedroom and out of your bed. But again, sleep hygiene, super key. Cool, dark, same time, same routine. Now, personally, I use this a lot, and I actually have this with patients a lot, is magnesium malate or glycinate, or a combination thereof. And you have to be careful because you can get too loose of bowels if you overdo it, but magnesium's a great smooth muscle relaxant. It's very relaxing at night, calming at night, helps GABA kind of release in the brain a bit. Anywhere from 400 to even like 1,000 milligrams. But again, too much, and you might sleep great, but you'll also might have some loose stools. Now, I parlay and kind of use synergistically with most of my patients, especially over the age of 40 or 45, 50, is slow release melatonin. That is a hormone. It gets you better, deeper delta sleep. And is very, very beneficial. Some people go to that just as the go-to, and that's it. But that is a hormone that we get depleted and lose from our pineal gland as we age. But, the dosing, more is better from a immunity and from a standpoint of health, but it is also a hormone. I keep stating that because hormones don't metabolically, metabolize real fast. So too much or too late taking it, you will actually be sedated in the morning. I only take personally like 3 to 6 milligrams, which is fine and really helps my sleep. And any more than that, I feel a little groggy. Now, I have patients take 20, 30 milligrams and up. Okay, so it just depends on the individual, but I say start low, go slow, and make sure that you take it, 9, 10 p.m., roughly about an hour before you go to bed, because, it will hang around usually about at least a good 8 to 12 hours. And you don't want to be groggy, in the morning. Now, we use other things like chamomile as a supplement or chamomile tea, Relora. We use L-theanine, which is an amino acid that's actually really calming to the brain. Personally, I love a few, in difficult cases, a peptide. You hear all these wonderful things about peptides, but sometimes we'll use to cool down the brain and slow down brainwave activity in the autonomic nervous system. A peptide called C-Lank. It's used as a nasal spray, crosses the blood-brain barrier very easily. And it even can be used in anxiety, but sometimes, I'll have patients use some C-Lank or even put it next to their bed, this nasal spray. So if they fall asleep with their magnesium and melatonin and cool room, dark, by the way, a warm bath can even be useful, before going to bed. But we'll have them put the C-Lank next to their bed. So if they need to hit that nasally, that really tones down rumination and thoughts if they wake up at 2, 3 in the middle of the night and need to get back to sleep. And there is really no side effects. In fact, people wake up energetic and clear thinking and all that. But there's a lot of tricks and things you need to do to sleep, and sleep hygiene part and, preparation and all that is most important. I also am a big advocate of exercising in the morning or earlier in the day and not in the evening, because when you exercise in the evening, you are stimulating yourself. So you're releasing dopamine. You're getting all these endorphins released, and that can be disruptive to sleep. Okay. So, if it works for you, great, but be, aware that too much stimulation physically in the evening might disrupt your sleep. Now, of course, don't fool yourself. Alcohol sleep disruptive. Caffeine, sleep disruptive. Usually the cutoff, I tell people, 2, 3 p.m. If they're sensitive to caffeine, they should actually not be having caffeine after 2, 3 p.m. because that will disrupt their sleep. And then the big one is, of course, at Longevity Health Institute, we evaluate hormones, all right? So if you've never had a sleep issue and all of a sudden now you've developed in your late 30s, early 40s, a sleep issue, or later, 40s or 50s, and you aren't sleeping, you definitely have to evaluate your hormones. The reason is because the even subtle decline in progesterone can make a big difference. And we often supplement progesterone, just to augment that a little bit in a, very early perimenopausal female or someone in their 40s, and that can be, golden and actually very healthy. So it's breast cancer protective, mood elevating, less anxiety, less rumination, hits the GABA receptor in the brain, but again, wonderful for sleep. But again, the biggest thing to take home is a sleep hygiene routine, cool bedroom, dark bedroom, get rid of electronics, eliminate caffeine, after 2, 3 p.m., warm bath if you need, but magnesium and melatonin are the first go-tos. And then again, some of these peptides like C-Lank can be used. So hopefully that is helpful. Another question I had is, what is new in the peptide world? Well, gosh, that's a big question, a big topic. I'll tell you what's really interesting, and I think I talked about this before a little bit, is one of the things that's new is we're going to be seeing a lot of these peptides, even the GLP-1s for weight loss and for diabetes and insulin resistance. We're going to be seeing a lot of these peptides orally. In fact, actually, there's a race in the corporate world in the pharmaceutical industry to convert these GLP-1 injections, so like these Ozempics and Wegovy's and Zepbound and all these. There's a conversion that they're really racing to make these a pill, because there is injection fatigue. Like, no one wants to take a shot, period. So if we convert these to oral, obviously compliance and ease. And the beauty is this: the studies on the orals, when they're done from either a liposomal, which is a technology so that they don't essentially break down, and they still have the benefits of the GLP-1 for weight loss, and you're not craving food, you have satiety, and you're sensitive to insulin and the insulin release and insulin receptor, so your blood sugars are going down and more balanced, so you're metabolically more sound. Is that these are safe, pretty much no side effects. Or very little if done right and dosed right. They're no different than the injections, and the compliance. And then the weight loss is only about a 3 to 4% difference, meaning the injection is stronger, more effective. You don't have to, everybody's gut system is, unique. And so how well you absorb and all that. But from a standpoint of ease, convenience, and that, these oral GLP-1s, peptides, are definitely coming very soon. We have them actually in our practice already, compounded. If somebody doesn't have injection fear or fatigue, I keep them on the injection, but it's always an option, which is really, really nice. The one last question I had, which was, pretty simple, but I love this, is the question about B12. What has for years, B12, always been used for energy, and why? And why does even my grandmother still talk about going into the doctor to get B12 shots? I love that. Well, because, by the way, we do that. If somebody is, it's so common, I'll have a 78-year-old in our practice that still loves her B12 every month or two. By the way, this is real. B12 is not just placebo. The deficiency, I think, and this is off the top of my head, but the deficiency nationally is about 10 to 20% based on ethnicity and if you're on medications, because some medications actually, like metformin, some of these GLP-1 peptides, the omeprazoles, the PPIs, the acid blockers, these are all proven to reduce B12 absorption. So even though you get B12 in meats and in greens and beef and things like this, you don't absorb it. And B12 is essential to myelination of nerves and of your brain. It is essential to making red blood cells so that you move oxygen in your body. And it is essential for DNA synthesis. So, common symptoms are like brain fog, fatigue, numbness, tingling, sometimes gait, especially if you're older, gait, an instability with walking. But what's amazing to me, because you bypass the gut, which about 20% of the U.S. population have an antibody to intrinsic factor, which you need in your gut as a carrier for B12 to absorb when you're just getting in your diet or in an oral supplement. So if we give you an injection of B12, and the best form is methylcobalamin or transmethylcobalamin, but when you get an injection of this, it goes right to blood, right to your red blood cells, right to your bloodstream. And the point is, it's usually pretty profound if somebody is insufficient or, in the lower quartile of normal. Now, if you know your labs or you've had your B12 tested, normal can be even from 200 to like 1,000 picograms per ml. So we shoot for the upper quartile. So we want it to be like 700, 800 or 1,000, because that tells us that in the red blood cell, in the tissue, you're getting plenty of B12. So just because it's quote unquote, oh, your B12 is normal, make sure it's at that, 600, 700, 800 mark. And there's no harm to a B12 injection. And if you get a result, amen. It's very, very safe. They're water soluble. And yes, we have many people that'll get a B12 shot, every week or two, or at least every month. And again, remember that there is a population out there that doesn't absorb B12, so they need them. And if you have this antibody to intrinsic factor, you need it injected, because you're gonna really, really lack the absorption of it. And I have seen multiple cases, hundreds, where people have gotten B12 injections and symptoms that they've dealt with a long time, like numbness, tingling, brain fog, fatigue, and they'll swear by them. And again, it's safe. So always optimize your B12. So, hey, again, you're going to wrap this up. This is an AMA. Ask me anything. We'll have more of these. These are great. These questions are great, and I think they really help individuals out there. If you're really enjoying the show and getting information out of this, share it with others, subscribe. I keep bringing you the best, guests on to entertain you, to educate you and enlighten you. And, this is all a journey, and about life is a journey to thrive and enjoy while we're here, love each other, create community, and keep learning and keep growing. Because, the deconstruction of thriving is thinking you have arrived. Remember, it's a journey, and hopefully I'm helping you on your journey and enlightening you on your journey. So be well. This is Dr. Lewerenz. We'll see you again here on the Deep Six Podcast.